Hello and welcome to not Morning Shot, Renegade Report. I need to focus on my words. But yes, good to have you here. I think this is our first live stream. And ladies and gentlemen, we have a hero among us, a frontline worker who's been battling hard, the scourge of COVID-19. And Jonathan Witt, welcome to the show. Well, I don't know why. You are part of the show. Essentially, you own half of it.
I demand that you thank me for my service. I demand that you thank me for my service.
It's a real pity because I don't have my pots and pans in my study, like to bang around, to bang them around, to show my appreciation for your time. Because I do understand doctors really appreciate the utter fuckery that is banging pots and pans whenever they walk by.
Ramon, in all my years in the medical profession, and it's almost 2 decades. In fact, it is 2 decades. Nothing has quite made me feel as whole as hearing people bang their pots and pans. So I really, I must commend people for doing that, because really before this I didn't know why I was a doctor, and now I feel whole.
I think they used to do that to harlots, whores, and slaves back in the medieval times. But now we do it for people that we trust. So, it's progress, guys. It's progress. Time goes on. And but anyway, Jonathan, it's good to have you. Everyone, thank you so much for joining in to our first ever Renegade
Report.
It's
not our first live stream, Ramon. I think we've done one or two before, but it's the first one for a long time.
That is very true.
For sure.
That is very true. And
we were pioneers, and then everyone else did their own thing. They got locked down at home, and we're like, I'll do a live stream every morning with coffee. Germ. So,
Germ just unashamedly copies everything I do, which is a compliment.
I am just looking to the side here, just so that I can see the comments so I can just load that on my iPad. So I am focused, but I just need to bring that up quickly.
So, Jonathan, before we start officially, right? You're a doctor, and now we're looking at hundreds of thousands of deaths. But no, that is not the case. As a doctor in the public sector, how are things looking from an objective perspective?
I think the as per what the NICD is telling you, the number of cases that are hospitalized are actually not that many. The numbers that are requiring ICU are even fewer. So things are not overwhelmed. If you are part of the hashtag Flat Curve Society, then I have good news for you. The curve is flat. We have not overwhelmed our healthcare resources. So if you are one of those people who bought into that or still does, that's great. Good news. We currently are doing well from a medical perspective. I do think seriously that if you are one of the people who said, look, we need to flatten the curve, we need to not overwhelm the healthcare systems, and we need to make sure we can do as much as we can for our population should they get sick, I do think that that's happened. We've had a lot of training of staff. There's been a lot of reallocation of people to various areas to deal with everything from testing for corona to ensuring that people will understand how to operate certain devices and systems and all the rest of it. There's even been some purchase of equipment. There's been quite incredibly development of various devices, which has happened almost overnight by very clever South African engineers who've worked on ventilatory type devices, not just ventilators. The stuff has happened in that respect, and I think to sort of deny it would be unfair, and to say that there isn't a better capacity. If tomorrow we needed to put 3,000 patients on ventilators, I think to say that there isn't a better capacity today than there was 6 weeks ago would be untrue. The real question is whether we'll ever need to actually do that, and whether we needed to do what we did to get to this point, or whether we could have done things simultaneously.
Right. But now, I mean, John, there's been a bit of an issue concerning free speech and talking about COVID-19, especially from people who are in the public sector, such as yourself. Now, what are you allowed to discuss, and what aren't you allowed to discuss?
Yeah, I mean, I can't really say, because if I say, then that'll be that'll be admitting to what I can't discuss. I can say that there's definitely pressure on people to not sort of color too far outside of the boxes. You're not going to hear me directly challenge anyone in authority who are directly my bosses in theory. So I'm really just not going to go there. It's just not worthwhile at this stage. For me, there's I'll chat with you frankly offline, but on a public platform, we need to be aware of what we say. Also, because sometimes things can be taken out of context. So yeah, there is stuff that I think people are not saying, frankly. But there's a lot of sort of inborn indoctrination into the system. I think we're seeing this at a societal level where 4 weeks ago, no one questioned the lockdown. Now we've got people virally sharing a sort of conspiracy theory documentary, and going, I wonder if this is true. So there's definitely been a move, and I think similar things have happened in the medical profession. I've seen colleagues who have been terrified by this. Specifically, mostly junior colleagues, but some senior, who think, who bought into the models, who bought into the Imperial College modeling, for example. When that came out, 2 million are going to die in the US, 500,000 are going to die in the UK. What does that mean for South Africa? We're probably all going to die because we're immunocompromised, or we've got a large population who's immunocompromised. They bought that sort of hook, line, and sinker. People very worried. I know there was nurses who were quite stressed out about the entire pandemic, to the point that there were isolated sort of threats of people not coming to work and not doing, certain tasks. As I say, isolated, and I don't really want to cast aspersions on any specific part of the professions, but I think there's been a lot of misinformation, and over time, that's going to come out whether there's a gag order or not. And, the state of disaster is ticking because they can do this for 90 days. And then they need, as far as I understand the legalities of it, they need justification to do it for an extended period. So they must enjoy the silence, because I think there's building questioning from everyone, not just doctors, but from the general public as well.
Yeah, but I mean, to me, first of all, okay, we sort of understand the ANC and the NDR. To me, this is my personal view as Ramon Kavanagh. The lockdown is very useful to extend the NDR and to accelerate the National Democratic Revolution. A lot of the regulations seem to not be linked at all to the virus itself, specifically the e-commerce one. And that has been obvious because Ibrahim Patel, when he was questioned about this, said, well, no, it's about fairness between spaza shops and Takealot. Like, what the fuck? Like there's any comparison. It's like saying, are we banning chiropractors because we don't want them to compete, or we don't want it to be unfair, like, to surgeons. Like, it's not at all the same thing, but there's a lot of ideology.
And spaza shops aren't stopped from trading anyway. I mean, exactly. Because spaza shops mainly sell groceries and sort of is what would be considered essential. So you're not, it's not unfair to a spaza shop to allow Takealot to sell a USB cable.
No, true, and they're selling a lot of cigarettes and alcohol, which I agree with. But but there's a lot of the regulations that are not linked at all to the virus, and which goes against everything that the international community says, right? But in terms of questions, Jonathan, I think let's just get there because there are quite a few here. Is there any evidence for this chloroquine that Trump was touting a few weeks ago, and are we using it here in a sort of testing period as such, or we're not even looking at that?
Yeah, there is evidence for it. I think, the problem is that all the evidence currently and all the data is not the way we usually do things. This needs to be understood. So, let's use HIV as an example. We took 20 years to get to the point of understanding that virus enough to be able to have treatments that were really effective with very few side effects. And that's usually how science works. It takes decades often to get to breakthroughs and to get to the point where we know enough to be able to say this is perfect. So I think everything that's being sort of discussed here is fits into the not perfect, fits into the yes, there's an argument against it. And it's the same. I mean, we can get onto masks later, but this is the same kind of logic, right? It's okay, does it do 0% or does it do 100%? Well, the truth is it does neither. It's somewhere in between. Hydroxychloroquine has some evidence for it. There are people who will argue that evidence. If you've been involved in evidence-based medicine for long enough, you will know that any paper you can usually find to promote one angle, you can find usually a paper to promote the opposite angle. So in my view, hydroxychloroquine, there is enough evidence to suggest we should probably be using it. It is on the last critical care guideline that I saw, the South African one. They were recommending the use of hydroxychloroquine, so we are using it. I think, once again, medication is all about risk benefit. So the reality is, if I give you a drug and I tell you, look, this drug may do nothing for you, but it may help your problems 10% of the time, but it also has 0 side effects, you're probably going to take that drug because there's no risk. So hydroxychloroquine is a relatively low-risk drug. It can have some cardiac side effects, but it's relatively rare, and especially for patients who are in hospital, who are being monitored, it's not particularly a concern. So yes, hydroxychloroquine, to answer your question, we are using it. It is one of the recommended treatments, but it's still up for debate about just how useful it is. The evidence seems to point to if you use it early enough, it's relatively good. And they're suggesting that sort of cocktail with azithromycin and zinc. And if you use it early enough, it should have some effect, not total, but some effect. But if you use it late, it looks like it's less effective.
Right. Now, I don't want to turn this into an interview of you based on your medical knowledge by any
No.
means. But let's
rip
rip on something that we both love ripping on, modeling. Right. So we had Professor Shabir Mahdi last week, who was the ex-head of the NICD, and he says, modeling, I forgot the quote that he said, like it doesn't tell you the truth, but we can find what is less useful than what is useful. And
all models are wrong. It's just what's less wrong, basically.
Right. And this has been proven this week, especially with Neil Ferguson. Now, whenever people said Neil Ferguson, I thought they were talking about the historian for some reason, because his name's also Neil Ferguson, and it's someone that I enjoy reading. But no, Neil Ferguson is I don't know what he is, because he's nothing.
He's a physicist. He's a physicist. He's not an epidemiologist. His qualification is as a physicist, which means he's a clever guy and he knows how to use maths. And he understands mathematics. So that's his actual qualification. But I think people who aren't aware need to understand that this guy works at Imperial College. He's been doing epidemiology. Obviously got into it, I assume, as some sort of interest at some point, and it became his thing. And look, a lot of scientists you will find are not qualified necessarily in the fields that they end up going into. You can look at all of the people involved in this. Anthony Fauci. Some of his qualifications lead him to disease, some don't actually. A lot of the people, CNN has, Sanjay Gupta, I think it is, who is a neurosurgeon. I mean, what he knows about virology is not that much, but he's a doctor. So who knows? He may have done a lot of reading into it. So look, the problem with this guy is that he's done models for 20 years. They've been wrong. Repeatedly wrong, but like by massive margins. And that would be fine if it wasn't for the fact that he did these models, which were all wrong, and then he does the model on COVID. He releases this paper which says things like, and I just want to say that it was with lockdown we were going to have shitloads of deaths. It wasn't if we didn't lock down. Go back and read the Imperial paper. The worst case scenarios in the thing included some sort of measures. And he releases this paper, and you need to understand the impact this had, because that Imperial College paper, because it's Imperial College and they've built a name for being Imperial College, that paper went to the White House. Was discussed with Donald Trump in a senior executive staff meeting. It went to Boris Johnson and 10 Downing Street. within the days that followed the Imperial College paper, the UK changed their entire approach to the coronavirus. They basically backtracked completely. They were going to
Yeah.
follow a more Sweden type model.
Yeah, they were
And
open
then
up, and then they were very scared, based on what Neil Ferguson said. But just for a little bit of context, Neil Ferguson, during the course
yeah,
of the swine flu in
yeah,
2009, he had a model then, and he predicted that 65,000 people could die from swine flu around the world. And he was arguing, close schools, let's prevent the spread, etc., etc. Very similar to what we're doing now for COVID-19. So out of the 65,000 people who were supposed to die, Jonathan, how many people actually died of swine flu around the world?
it was far less, Ramon, if I remember correctly. It was a few hundred.
500. 500 people died
Yeah.
from swine flu.
His
So,
Ebola one is quite spectacular as well.
oh, really? What did he say about
If I
Ebola?
remember, he predicted something like 2 million people would die of Ebola, and 800 died. So,
But why,
so
but I mean, let's talk just about the cultural aspect of this. Why is someone like this taken seriously? It sort of like reminds me of those weird climate change activists who said, there'll be no polar bears by 2013. Like, if you go watch Al Gore's An Inconvenient Truth, which was made in 2008,
yeah,
you watch
I
it
think so.
today, it is the biggest crock of shit you've ever seen in your life. Like, it's completely fake news, and they should go to jail for
Yeah.
fake news. But these people are still sort of venerated in life. They're never held responsible for what they get wrong. And in this scenario, Neil Ferguson got something wrong dramatically. But the effects of his paper has been like untold misery and poverty and economic decline around the world.
Yeah. So look, I think there's been a positive feedback loop, and it's been an incredibly destructive one with coronavirus. And so, what's happened? I'll get into Neil Ferguson personally because I think there's a political aspect to this. But the sort of positive feedback loop that I can see is coronavirus comes along. Initially, the politicians and a lot of the modelers say, don't worry, there's nothing to be concerned about. That's sort of January, early Feb. That's where you've got Fauci going, this is going to be a bad seasonal flu. You've got other people downplaying it. Trump downplaying it on the basis of what his experts were telling him. It always interests me that everyone thinks he just says everything on the fly. That stuff was informed based on what he was being told in briefings. And the truth be told, so did Angela Merkel, so did lots of other people. Not downplay it. I mean, Bill de Blasio was saying, go to Chinatown. So was Nancy Pelosi. I don't hold it against any of these people, by the way, because I think at the time that's what happened. So you have this virus, it comes out. I do think there's a lot of Chinese misinformation that comes into that in terms of an understanding of what the impact was going to be. So it wasn't going to be a nothing, but it wasn't going to be the worst plague we've ever had, but it also was going to be something. And I think at that point it was more the nothing end. And then what happens is the media gets hold of this and they're like, this is an opportunity for us. And if you think about it, no one's benefited more than the media through the coronavirus campaign. I mean, you yourself included, Ramon, more people watching Morning Shot, but at the same time, I would bet that ratings and in terms of eyes locked onto screen for CNN, CBS, Fox, you name it, in the United States and across the world have been greater because people are at home and now they've got this virus that's going to kill them and they've got to watch the news to find out just what they must do so that they don't die. And so the media grabs onto this and they start peddling the fear. And the public then goes, oh my God, there's this virus and we're scared. And that feeds back to, in this positive feedback loop, that feeds back to the politicians who are getting a message from people going, what the hell, you're not doing anything, you need to do something. And so then come the modelers and they go to the politicians and they go, yeah, we agree, this is going to be catastrophic. And the politicians, with all this noise, react to it. They lock down, the media doubles down on the fear mongering, and the public gets even more fearful. And so you have this sort of feedback loop. And only now, in the last 2 weeks or so, have we started to break that feedback loop. And that's because what's come in there is no change in that, really. But what's come in is people's wallets and bank accounts and livelihoods and their actual existence has started to crumble. And so they're starting to go, okay, I'm scared still of what I've been told to be scared of by the media and the politicians, but now I'm more scared and I'm getting more scared about the other things that affect my life. And so that's what I think really is going to be very interesting to look back on. And obviously, thanks to the internet, we'll be able to see the sort of process that took place. In terms of Neil Ferguson, I think the guy's a leftist, dude. He has lefty politics. He's the kind of guy that would have voted for Jeremy Corbyn. He got caught breaking the coronavirus lockdown with his mistress, his married mistress, who, yes, I am making a moral judgment, with his married mistress, who came to his house during the lockdown. And she is a climate change activist and an anti-Tory activist. She rails against Boris Johnson. These are the people that are behind all of this. And so the thing is it's not a conspiracy theory that they've tried to manipulate anything. I think, though, that an opportunity has come along and they've really just gone, great, this is an opportunity for us. We're going to use it to advance an agenda. And you can already see that. Go back and look at Barack Obama's tweet from 2 weeks back. He was already pivoting this to go, you see, these are the global challenges we have as humanity, and this is why we must tackle climate change as a unified force.
Right. And then you bring into that like the World Health Organization being a completely corrupt institution. You see what China did to sort of combat the coronavirus out of fear and out of embarrassment. They welled people into their apartments to die, knowing or maybe not knowing that the coronavirus, is something with the mortality rate of, what is it now, 0.3, 0.6%, depending on where you are and depending on the model and a variety of other things.
I had a friend message me and he sort of said, look, what's the truth here? What's the story? Is this a really terrible virus? Is it not a terrible virus? And I said, look, as far as I can tell, this is where we're going to end up. We're going to end up where we say, if you are under the age roughly of 20 years of age, this is a virus which has no threat to you, zero. Yes, there are a handful of children that have died, but when I say a handful of children, it's literally a number so small that when you work it out statistically, it tends towards zero. So if your child's had multiple cardiac surgeries by the time they are 3, perhaps you should be isolating them. But every other child on the planet should be doing whatever the hell they like. So if you're up to age 20, you're going to have what's your mortality from coronavirus? Probably well less than flu, in fact. If you are between the 20 to 40, debatable, because 40 to 50 is a bit of a gray area, but 20 to 40, 20 to 50 age group, then you're looking at a virus that probably has the same threat to you as influenza. So it's a similar virus to dying. Your mortality risk is similar to dying of flu. And then there's the 50 to 60 group, which is a very gray area and would rely heavily on whether you have comorbidities. And then I think the 60 and above group is going to be the group where we look at it and go, okay, this was a virus which potentially can be, the original kind of 10 times worse than flu and 3%, 4%, 6% mortality rates, etc. So I think in a certain age group, that's really where it's going to sort of split up, and that's why the reaction to this has been so irrational, because we have not treated this like we treat every other disease in medicine. Anyone, and as we all know, Ramon, your wife's a doctor. So if you ask any doctor, they will tell you that when you go to med school, one of the things we very much focus on is the epidemiology of disease. So every disease, you sort of start off in the lecture and it's like, okay, the definition of the disease, and then it's epidemiology, and you learn about the population that it usually affects. So for example, prostate cancer, you would have the slide would say affects men.
Ooh,
right?
A bit touchy there. Men have balls. I mean,
Yeah,
some women have balls too, please. There's 52
some women
genders.
have balls, yes. So obviously nowadays it would say affects men, and then it would have a star, and then it would say and women with penises.
No, testicles. Testicles.
Well, it's got to do with your prostate. So you don't, even when they take these, when you become a woman, if you're transgender and you go from man to woman, you don't lose your prostate. So
Right.
I don't think they take it out of you.
By the way, it's the only charity that I support, women with testicular cancer. It's criminally underreported and not at all a popular charity, but it's one that I support fully. But anyway, yes, John,
I
yes.
think you should post the link in the description below, Ramon, so we can all donate to that charity. But yeah, look, so prostate cancer, they'll say, okay, and look, this is a disease that affects generally men over the age of 50. We start screening for it at about age 40, depending on which guideline you look at. So when a 20-year-old walks into their general practitioner, unless he's got very, very, very sort of specific symptoms, no 20-year-old is getting a prostate exam, which all the 20-year-olds, all the 20 to 40-year-olds will be very happy to know about. And if your GP has been doing prostate exams on you since you were 20, you should start asking questions. But
Very true.
the point is that you don't, so 20 to 40, we don't look for prostate cancer. Now, does that mean prostate cancer never happens in 30-year-olds? No, it doesn't mean that. It just means that it's so rare and it's of such little concern that it's not something we screen for. It's not something we look out for. And so coronavirus is similar, this coronavirus, the specific one. This is the type of thing where we should be going, oh, you're over 60 and you have high blood pressure. Okay, cool. Coronavirus is a real concern. But, if you're looking at a 20-year-old, we should be going, we could care less if you have coronavirus or don't have coronavirus.
Yeah. So, but also it's that sort of case where, for example, people will say, well, if you're asymptomatic and you have the coronavirus, the fear is that you go home and give it to your grandmother or something to that effect. Therefore, we're going to lock down the country so that people don't move around too much. Now, how does that compare to normal viruses beforehand? And this concept of herd immunity. Is herd immunity a real thing? So the more people have it, the more the virus dies out. And I read only today that the herd immunity for corona seems to be 20% of the population rather than originally 60% as was believed before. So does herd immunity exist? What is the target range of herd immunity? And why is that not a viable way to target COVID? So essentially more people should have it rather than less.
Well, Ramon, if you remember when we recorded the original Corona podcast that we did together, one of the things I mentioned was that we should possibly, if it was a thought experiment, I mentioned that we should basically be purposefully infecting all the children. So we should get all the children back to school. This is once again a thought experiment, so I don't get reported to the Human Rights Commission or something. We should get all the children back to school, and then we should take aerosols of the coronavirus and we should literally spray it over the schools as we fly over with crop dusters. Now, obviously, I'm being a bit flippant, but the point being is that, yes, herd immunity absolutely does work. It's the entire idea behind how vaccines work. And the reason they work is, if you remember, when everyone started panicking about the coronavirus, there was those videos, those short videos that went out where it had this in person then infects these 4 people, and then those 4 people, then 16, and then 16 becomes, and it was exponential growth. I don't know if you remember exponential growth. It was only 2 months ago, but it's disappeared.
I do.
Look, coronavirus is exponential to a point. I mean, it's got an exponent, but it's not exponential in the way it was kind of sold. But the other video that I think displayed it quite nicely was there was that one where someone lit a match, and next to the match was another match and another match and another match. And the matches were too close. Obviously, all the matches caught, and every match that caught fire was basically a coronavirus person passing on coronavirus. So all herd immunity does is it does exactly that, right? It does social distancing for you, because what it does is if every second match has had coronavirus, then what happens is the coronavirus can't jump to the other matches. And that's exactly how vaccines work. We try to get vaccine. If you can get vaccination of more than 90% of a population, or immunity, herd immunity of more than 90%, you see the eradication of a disease. So measles, for example, if 90% of a population is vaccinated, we don't see measles. It's not able to sort of rise up and infect the remaining 10% who are unvaccinated. Yeah. So what would happen with corona? Well, look, you saying 20% and some saying 60%. I think we don't know that yet. this is some of the criticism that's been on the serology studies. That there was the one done in Stanford, that's the Facebook one, which was criticized quite heavily, but it's a guy that I personally have a lot of faith in, John Ioannidis. And they did a study and they showed that this was 60 to 85%, 60 to 85 times underdiagnosed. There's other studies that have been showing less. So some show 16%, some show 20%. I agree with you. It's hard to say at the moment. But certainly this is, the more people who've had it, the harder it is to pass on. Because I touch the door handle after sneezing into my hand, and then you come straight along and touch the door handle. If you've had corona, it doesn't matter. You get a little bit of my protein, but other than that, we're all good.
That's the worst pickup line I've ever heard in my life. Yeah.
I'm trying.
Right. But speaking to you offline and speaking to a few other people who are like doctors and things like that, it really seems like, and I'm going to be very, very polite, a lockdown scenario is completely illegitimate. I'm sorry to say, Joe, I don't know what you can say about it as a public sector employee, but it's completely fucking illegitimate, this whole thing.
Yeah, I think it's the wrong approach.
No, not just wrong.
I know.
Wrong. Not even in the realms of yes, maybe. No, it's like no, like completely and utterly wrong. It's like sort of trying to fix an arm by breaking it twice.
Yeah, well, the example I gave weeks ago before the lockdown was that the lockdown was essentially the equivalent of a surgeon cutting off your entire leg because you had one gangrenous toe.
Yeah.
And I think from a world economy perspective, that's roughly what we've done. So the issue is this whole thing about what do we know about the virus, who does it really affect, where is it bad, etc., and also about lockdowns. Like, look, the data we have from influenza. And influenza is a respiratory virus, just like this is a respiratory virus. In other words, it passes from people's respiratory tracts into other people's respiratory tracts. We can get into the debates about how it actually kills you. But it's very similar in that respect. And, the reality is we know that when people get influenza in winter, they get it usually indoors. They get it in their houses. In fact, one of the reasons why it's a winter thing is because what happens in most places in the world is, and you think about your own household, it's winter, it's cold, right? So you don't generally use your whole house. You're not outdoors. You're not outside. You don't go into the cold rooms. You spend a lot of time usually in certain spaces. So living areas, one living area commonly, the lounge, for example. And you're all sort of huddled there in the lounge with blankets and with heaters and whatever it happens to be. Maybe watch some TV. And that's really where a lot of the spread happens. And in fact, we knew this about influenza. We've always known this about influenza. So if you want to save your grandma and you're worried that grandma is going to get coronavirus, then that's where you should be worried about giving her the coronavirus, right? That's the real concern. Walking on the street is not a place she's going to get coronavirus. And it's not a place she's going to get influenza either. That old wives' tale of, if you're cold, you'll get flu.
Yeah,
that is an old wives' tale.
Yeah.
So, yeah.
Yeah. No, but I think
and now we're getting evidence about the coronavirus. It says the same thing. It says, look, indoors is the place we're spreading this. They think in New York, the two places that they had major spread, one was the subway, which, by the way, they only decided to clean yesterday. Yesterday, yes, May. And the other place that majoritarily it was spread was in nursing homes. So, and in Italy, they think that the lockdown might have made everything worse because once they started to get a massive rise in infections, they said, all right, let's lock down. And they sent multi-generational homes back to live with each other. And we'll only know in time once the stats have been sort of paged through and looked through for what I think the epidemiologists will be useful for. So not predicting the future, but for actually looking at the past and being able to pass out the data. That we're gonna learn a lot from this, but it's gonna be very painful.
It really is gonna be very painful. And I retweeted this great Twitter thread. I think you retweeted it as well. The guys like epidemiologists are full of shit, and this notion that you can sort of you can predict a model on a virus is bullshit because how sick you get depends entirely on an individual's immune system. And they're all different. Some are good, some aren't good, some are medium. But there's too many variables in here to actually create a model that's real.
I mean, I think what we've done as a society, as the world, and specifically as leaders, they've literally gone. They've been driving on the road, and they've seen one of those caravans with one of those fortune tellers on the side of the road, and where it's like, $200 palm, 200 rand palm reading or whatever it is, and they've literally pulled their car over and they've gone inside and they've said, please tell me what the future of the coronavirus is. And that is what they've asked of epidemiologists. And really what epidemiologists should have said is, look, we can try and give you a guide and an idea, but we cannot basically predict this. And unfortunately, I think people like Ferguson, for example, was too arrogant to say that. And instead of saying that, said, here's a model and this is what's going to happen. These people are playing fortune tellers, and no one in the world knows the future. It's not possible to do this. And yes, I mean, on the immune stuff, you're 100% right. A lot of the research that's going into bacterial sepsis is around how people genetically are predisposed to fight sepsis or not fight sepsis. So we don't know why one 30-year-old gets a really bad bacterial infection, gets sepsis and dies, and another 30-year-old gets what looks like the exact same infection and is perfectly fine. And the belief is that there's a major genetic role, and that treatment and therapy should target that genetic role. So yeah, I mean, that's true around immunology. I think you can have an idea about how population, disease and how it will affect populations. The problem here is that we listen to only epidemiologists and only the scientists saying the worst case scenarios. And there was no one going, okay, get me an actuary, get me an economist, get me people on the other side of this who can tell me what's going to happen if I tell people that they can't work for 2 months, that they can't drive for 2 months. What's going to happen to the oil price? I mean, that should have been obvious.
Yeah, but it's not even that. It's that they seem to listen to people that will give them more power, right? So I mean, if someone says, okay, in this scenario, politicians, you're going to have absolute power. You're going to have a state of disaster. You're going to tell everyone to stay at home, and you're going to make sure that they don't starve to death. And politicians are like, holy shit, this is like my wet dream, man. This is why I started to be a politician. I can centralize all power, and I can send the army out onto the streets, and I can whip people for not doing something that I don't like. Like it's like manna from the heavens for these fucks.
Yeah.
And the problem is, and Lynn, I see your question. The politicians will never admit that they're wrong. In South Africa, if there's no surge, they're going to say, oh, look, the lockdown worked, guys. The lockdown worked. There's no surge whatsoever. If there is a surge, oh, we didn't lock down enough. That's why we have levels. Now we need to go up a few levels. So there's
It's
no
unfalsifiable,
winning.
right?
There is no winning with the politicians. So that's why the lockdown works or doesn't work. It doesn't matter. There's always a reason to have a lockdown, especially on different levels.
Yeah. I mean, Ramon, you've been following this closely with regards to the power grab on the South African government side, but it's been everywhere in the world. It's more pronounced here, I think, because we've had the worst lockdown in the world besides for China, probably. The measures that have been taken have been the harshest, without a doubt, in South Africa. I mean, maybe Singapore but Singapore was like a week that they went through this sort of hard lockdown, a week or 10 days. We this thing of not being able to exercise, this thing of we've had a great restriction of our constitutional rights. The reality is if you go read the Bill of Rights and you look at what you currently have now and what you had 3 months ago, they are chalk and cheese. It's completely different. But I mean, you would have noticed this is a political plan. I mean, would you agree with me on that? It's part of the plan.
Oh, my friend. Why have enemies when my friends don't watch the shit I put out? Have you been watching Morning Shots? I've been banging on this drum for the past month.
I'm aware. No, I am aware.
So yes,
I'm
this is
aware, but
this is
I'm
a
not sure
complete
that I'm
political
not sure.
play.
Ramon, some people watch the Renegade Report, which is slightly higher quality content than Morning Shots. So I'm just, I'm
Just
letting them
because
in on them in on the secret.
right, just because you're on it with, just because you're on it. But yeah, of course, this is proper political because we understand exactly how the government works. We've been banging on about the NDR on this show for 4 years, and now finally people are thinking like it's not heresy to say the ANC are communist socialists, right? And even then, they're very incompetent at doing so. And even then, at the time where they could be the most communist possible during the course of a lockdown, they still fuck it up with stupid crap. Because the townships are not on lockdown. I've spoken to Nati Kwazai, you've spoken to Nati. They are in Khayelitsha, they like going on as life goes on, right? It's the bloody middle
Yeah.
class people like us, who are idiots, and who think that yeah, lockdown actually matters and we need to stay at home. This is all really seems to be a middle class lockdown and squeezing the middle class as much as possible because they're the ones with the most economic and political power. And if you can fuck the middle class completely, ANC wins for a very long time.
Yeah, I mean, there's two sides to that, and one is screwing the middle class. Remember, though, that the middle class pays the majority of the lower classes' salaries, and I've for me, it's been a real worry. Since the beginning of the lockdown in terms of, and I posted just before we went into lockdown, if you're going to a restaurant tonight, I think my tweet was something to the effect of, if you're going to a restaurant tonight, understand that the waiter serving you is not going to get a salary at that time. It was going to be for a month. He's not going to be able to feed himself for a month. And if you think about it, every single one of those types of people, the people who serve you your food at a restaurant, and the people who cook that food behind the scenes, the people who clean the floors when you go to a shopping center, the car guard who just sort of irritates you and tells you how to drive. But every now and again you give him $2, $5, whatever it is. The petrol attendant who petrol stations are open, but they're not pumping any gas. So I'm sure most of them have told most of their staff not to come to work. Those guys earn a lot of what they get off tips as well. And a lot of the businesses that are saying to people don't come to work are not paying those people, or they're
Yep.
laying people off. I know lots of people, and more than I can count on my hands, who own businesses or employ people, and I don't know any single one of them who is not retrenching someone at the moment. In one instance, I know of a company retrenching more than 100 people. And I know that for those who own businesses that are larger and employ several thousands, that's going to be in greater numbers. So, this is the real catastrophe of it. And even if you sort of pin the middle class down, you're also pinning everyone else down, because the middle class is what the country kind of runs on. The middle class go and do all those things. They use all those services. Those services are supplied by people. Those people earn money off it. And so, so sadly is that so many people in the country live on a sort of day-to-day, hand-to-mouth basis. I mean, it's really tragic. And you saw obviously the report that Panda put out, which is the pandemic data and analysis team. If you look at the maths, and they were very careful in the maths that was done there. The It was known from the time that the analysis started that people would look at it and go, oh, no, this is just trying to sort of make the opposite side of the argument, and you're just trying to fiddle the numbers. So when the analysis was put together, a lot of that was done taking that into account. So trying to be as conservative as possible to try come up with the what's probably not realistic. It's probably going to be far worse than that 30 times, by the way, because that 30 times is almost a best case scenario. So 30 times more year lives lost as a result of the economic damage than will be lost through the worst case scenario of coronavirus. So really, when you read that, you must understand that they've taken worst case scenario of coronavirus, and then they've taken best case scenario for the economy. And it's still 30 times worse in terms of what happens to the economy.
And to me, it's a conspiracy, but I think it's all completely planned, especially looking at the irrationality of the regulations. We have some super chats, Jonathan, by Herman. Herman is actually going to join us very soon on the show. He's a tobacco farmer. And he asked, why
Yeah.
are ciggies factories being raided and tobacco farmers being arrested? Well, because the ANC made laws on their own accord. And if you ask them for the reasons for why tobacco is not allowed, they say, "Oh, we can't give you the reasons. It's classified, like part of the fucking CIA or something," which is illegal, by the way, because under the Disaster Management Act, which is in tomorrow's video, you have to have something that's transparent and open to the public. The framework has to be open and transparent. And the impact on agriculture in this country, yes, is immense. And I think, to be honest, the long-term plan for the ANC is, let's fuck agriculture, and we can buy shit on the cheap, or we can expropriate because it has no value anyway, which is what the Constitution allows right now, by the way. So unfortunately, Herman, you may be the guinea pig.
Yeah.
And the ANC
I think this is happening
has a
across
real-
sectors.
Yeah, absolutely. If you look at the relief funds being used for BEE firms only, I mean, it's so obvious that the white-owned firms, which is a bullshit term, they're going to go bust, and the BEE firms are going to fucking buy them out. Very simple.
Yeah. Yeah. And also remember, one of farming and agricultural's big sort of pros in this country is how efficient they are, and how good at delivering they are. It's actually very hard to farm. I don't think most people realize how difficult it is to run a successful anything farm, frankly. It doesn't matter what you're growing. I had a good friend many years back whose father owned a citrus and chicken farm up in Tsenin. And, he would tell me some of the stories, and it's just, you can have catastrophic things to happen to an entire sort of pen of chickens. I don't know if they call it a pen or what they call it, but the point is one of those big sort of low roofed sort of areas where they keep the chickens. When you drive past Rainbow Chickens, you see these sort of places, and you can have that entire thing die overnight if the temperature drops. If a heater fails in winter, or you arrive to 100,000 dead chickens. So farming is no joke. It's really a difficult thing to do, but what's going to happen here is government seeing this, I think, and going, well, there's going to be no demand in the market, which means no one's going to buy your shit, which means you're not going to be able to pay your bills. Most farmers actually are in debt because they have to continuously borrow from the bank so that they can replant, and then they pay the bank back, and then they take whatever is left in profit. If they know that they're going to collapse everyone from farmers to other businesses, and then, as you say, come in and either buy them on the cheap. But the other thing is a PR campaign, Ramon, to be able to turn around and go, why you can't find a chicken on the shelf at the grocery store? Because farmers aren't able to deliver for you. You know who can deliver for you? The government.
Yeah.
We will deliver for you.
Yeah. And it's quite brazen to me, and people still think I'm a conspiracy theorist, but it is rather quite brazen, especially considering when the, when Cyril Ramaphosa says, the COVID-19 virus pandemic offers us a great opportunity to start a new economy based on radical economic transformation. and no one says, we heard that term before, it's fucking bullshit. No, they just say, okay, this is what he said. But hello guys, they want a revolution. They want an economic revolution. They're admitting it to you in your face right now as reporters, and no one makes the link that, okay, so they're looking at an economic revolution, they're getting there by having this lockdown, which is related to the pandemic, but perhaps the lockdown was necessary for the first 2 weeks or 3 weeks. We sort of understand. We're waiting for data to come out. The data's out now, and they're still continuing the lockdown indefinitely, by the way, because now they've got levels, and then at the end of it, they say, once it's all over, we're going to have an economic revolution based on radical economic transformation. And Gwede Mantashe comes out and says, by the way, the regulations for mining that exist now under the lockdown will exist post-lockdown for many years to come. And it's not fucking obvious to someone who has 2 brain cells to think, maybe this thing's not about the fucking virus. That's just me. That's just me as a conspiracy theorist. What do you think, Jonathan?
Yeah.
Am I a conspiracy theorist?
So the conspiracy theory would be to say, and I know someone asked about that pandemic thing, so I'll talk about it. But the conspiracy would be to say something like, well, the virus isn't really a problem and this is all being done for government manipulation. I think that's a conspiracy theory, which is relatively easy to disprove, but obviously some people will buy into it. But not a conspiracy theory to say, no, there's a virus. It can be dangerous and it does kill people. And even to say that the lockdowns and a lot of the sort of actions by governments was done because they believed that that was the best thing to do at the time. It was in the best interest. Now, you might believe that or not believe that, but I think Occam's razor, you probably find, look what was happening 6-8 weeks ago. There were not many people questioning this. Okay. There were very many smart people.
Including me. I said, the first corona report, I said, yeah, maybe we need a moderate lockdown just to make sure we understand what's going on here. So
100%. Yeah. But I think given the information at the time, you can understand that. Imagine you're the president or the prime minister of a country, you're sitting in a room and all the clever people are saying to you, this is very bad. The modeling looks terrible. People are going to die. Look at Italy. They've got bodies sort of piling up in the corridors. We got to do something about this. And I think up to that point, there's no conspiracy. No one's trying to do anything. The problem is then they put things into place and more information now comes out, but they look at the effect of the stuff they've put into place and they're like, actually, this is an opportunity. And I think this is happening across multiple sectors. You're going to watch Warren Buffett is going to come out of this richer than anyone. Bill Gates is going to come out of this richer than anyone.
I was about to say Bill Gates,
there are several.
Yeah. Go ahead, sorry.
There are several scientists who are going to come out more published than they were before this, by being able to constantly submit journal papers which basically say fuck all to journals and are being accepted into major journals. The New England Journal of Medicine is basically the leading medical journal in the world. If you want to get published in there, the stuff you need to put in there is so groundbreaking generally, and generally takes months to years to get published. We're talking about review that goes back and forth where they make you change little words and they know they want a graph on this and no, we don't agree with that and show us the data. And, these are things that normally happen. Well, there's been tons of publications from everything from Nature to Science to New England Journal of Medicine to Lancet. People have been publishing. So there's lots of people capitalizing on this. Some are doing it in a monetary way. I think there are businessmen who are doing it in a monetary way, and I think there are scientists who are doing it in a growing their own profile way, and I think that there are governments who are certainly doing it in a power way. And so the ANC may have that first speech that Cyril gave where everyone was like, we are led, praise the Lord, where everyone was like that. You can argue that that was a genuine speech where nobody was trying to do anything untoward. Yeah. But then I think what happened was people sat down for sure. This isn't a conspiracy theory. This is obviously happening in front of our eyes. They sat down and they were like, right, we've got these people right where we want them. We've got the evil free market failing, essentially. And we've got an opportunity to do exactly what the NDR says, exactly what it says. And let's take the opportunity. It's been presented to us.
Yeah. No, and that's my theory too, if I'm honest. I just want to pay tribute. Sorry. If you do have a super chat, I'll just say thank you to Joe Space and Johan for your kind super chats. Thank you so much. But I think, did you watch the presentation by Franz Crinier today about his new book? The Rise and Fall.
Unfortunately not. I wasn't available.
Saving lives. Just say saving lives, John. We'll believe you. So I didn't watch it, but I have listened to the podcast, and he says, and Russell Lamberti says this as well, and it's very, very interesting. This is an accelerant. The COVID-19 pandemic and lockdown is an accelerant to the demise of the ANC as a leading political party in the South African political sphere, because we know, based on the Institute of Racial Relations, that people vote for the ANC based on the material conditions of their lives. And this is evident. Thabo Mbeki got 70% of the vote when the economy was at 5% growth and a huge budget surplus. Then you had 2008 crisis. Zuma won with 64% of the vote. Then we middled along, and then what was the other one? I can't remember, 2014 or whatever it was. He got 62% of the vote because the economy wasn't doing too well. And even with the Cyril bump, right, Ramaphosa was a real thing because everyone from Peter Bruce to Adrian Basson to all the
Mm.
ANC sponsored media in this country gave him a lot of space and airtime. He got 57%, right? And there was a huge amount of Ramaphosa back then. The ANC was at 42 without him. That was evident. But this log, assuming there's another election, assuming, which is not that, and we still don't know to this case, assuming there's another election, the material conditions of South Africans is basically devastated for another half a decade at the very least. And therefore, the ANC will probably lose the next election, should it happen, based solely on the trends against them. And this has certainly just accelerated those trends to a degree that they themselves cannot control.
Though, Ramona, I think, in a country with a free press, where there was debate about issues, I might sort of say, yeah, 100% am on your page. But I worry that we have a media who will spin this. We can use the US perhaps as an example. Uh, it doesn't matter what Donald Trump does; they will never credit him with being correct. Okay, I use it as an example because it's a very sort of black and white situation with the media there. Um, it's very clear that our media doesn't necessarily want one particular person to be in power. So sometimes they like Zuma, then sometimes they like Ramaphosa and whoever else they'll like next. I mean, you must watch for the shift. It will come. At some point, Ramaphosa will become unpopular and they will shift their support. And suddenly we'll be reading puff pieces from Adrian Basson or his concubine Pitta about how Didi Mabuza has been maligned and is actually a great guy. Or we'll be reading about how there was never any evidence against Ace Magashule. Or they'll pick someone and they'll run with that. It's very clear to me that the media in this country doesn't back a singular horse. They're happy to change horses, but they're not happy to change teams. The ANC must rule. The ANC must remain in power. And so I worry that, yes, in a free press environment, perhaps, perhaps they really will end up being unseated from power because the free press would go, they fucked up, right? And this is how they fucked up. And other people will turn around and go, no, they didn't. And so you'll have this argument that happens, which does to some extent still happen in somewhere like the United States, because at least you do have Fox who argues against MSNBC, and they're coming from completely different ends of the spectrum. We talk about our alternate media, but let's talk about reach. ENCA has far greater reach. That's just one platform, has far greater reach than me, the Renegade Reports, Ronaldo, Germ, Valdemar's show on CakeNet, all of the stuff that seeks to try and tell either the similar narrative, but with a different interpretation or a different narrative, whatever it happens to be. So I just worry about that. I don't know if they will really be taken down by this.
Yeah.
Wait for the third force story to come along. Maybe it'll be, well, we never believed in a lockdown, but it was the Americans who told us that we really needed to lock down. That Imperial College, it's even got imperialism in the name.
Yeah.
They were the reason. I don't know.
They will pull their bullshit. I mean, I'm not an optimist. I hate optimism because optimists die first in a war. It's something I tell myself over and over and over again. But I think Frans Cronje hasn't been wrong once. And he's got 90 years of evidence to dictate what he says to us and to the world. I haven't read his new book yet. It is out on Amazon, but I will be reading it soon. But I think we maybe also we overplay the importance of media on people. Because the most widely read newspaper is the Daily Sun, which is decidedly non-political. It's more scandalous than political to some degree. And I think people will see the material conditions of their life and look at the media who says Ramaphosa is great, and they're like, no, like my reality is this, you saying this, and that is not at all what I'm feeling, so how can I trust you? So I think skepticism will naturally grow irrespective of how sycophantic the media might become, or they already have been very, very
I hope so.
sycophantic. We will see. But what has been nice, as Franz said, the EFF are not growing during this period of time at all. They sort of seems like
Yeah.
reached the max. But the danger there is that they will go back to the ANC in 2024. ANC gets 45%, EFF gets 10%, and they still fucking rule this country for another 5 years. Except Julius is our Minister of Justice and says, all the courts are revolutionary places for the people, and we must crucify the whites by their necks, and that's a problem as well. But yeah, it's a very interesting times, and I think the ANC have really overplayed their hands here, and I don't know if they can put the genie back in the bottle anytime soon.
Yeah, look, I want France to be right. I mean, make no mistake. I want you to be right on that last statement as well. I would hope. I think the EFF is basically. I know you say media doesn't necessarily have that much of an effect, but I do believe the EFF is literally a media-created political party. There is no doubt in my mind, and this has been widely studied, and it's fact now that the EFF gets far more press coverage compared to its size than anything else in the country. What's really happened during this time is that the EFF has nothing to say and nothing of value to add.
Well, except they have said two things, right? If you sell cigarettes,
Yeah.
you for black genocide, which is weird because
Yeah.
most black people in this country smoke. Well, there's more black smokers than white smokers, just based on demographics, right? So black people want their own genocide, which is always interesting. And number two, gem equipment should be sold as an essential item because it's important for the revolution that people are fit and healthy, so that when they go to the gulags, they can contribute adequately to the glorious People's Republic of Azania.
I think you're overinterpreting. I think that gym equipment quip was probably just because one of them has just built a house in some nice leafy suburb of the north, and probably their home gym's looking a bit empty.
Yeah,
So they've got the
estates.
cinema sorted out, but the cinema is top notch. And they've probably still got their live on domestic laying out their Gucci t-shirts in the morning, but
That
but
video, Jesus.
they don't have they don't have their weights, so they really need those. Yeah, look, I really do hope that the EFF takes a knock. I really do hope the ANC takes a knock. What do you think of the DA? What do you think of their performance so far? I feel like they started out strong and then sort of.
Yeah, I think they've been very timid. So I've actually devised a plan. We need to get Alan Winde arrested. And I'll lay it out because I'm writing a piece about this. We need to get Alan Winde arrested in his lycra suit where he goes cycling. Because he must be cycling after the designated exercise hours as deemed by the Glorious Republic of the ANC. And we need a camera crew to follow his every move, and he must get arrested by the police on purpose. On purpose.
Yeah,
And
sure, because then he becomes a freedom fighter, essentially.
indeed. And then we need Johnston and Hazen to go to Kailicha, to all the spaza shops, and buy all the cigarettes and alcohol that's for sale, and just dish them out to the masses on camera too. And he must get arrested as well. And the driving point is once you have all that publicity, the DA says, listen, ANC, we are following the World Health Organization and saying that the Swedish model is what's going to happen in the Western Cape. Take your shit out of here. The Western Cape voted for the DA, and we're going to set the rules here. I don't give a fuck about your lockdown. I don't give a fuck about your Disaster Management Act and your hot food bullshit and your fucking e-commerce crap. Fuck you. Western Cape is mine. It's my fucking house. And
Yeah.
I will do what I want because I was voted in by the people here. If they had balls, they would do that. But they just want a lockdown with cupcakes, rather than no lockdown at all. And it's sad. I mean, I'll be glad to help them out. DA, if you are watching or listening, call me up. Only like R500,000 a month retainer. I'll get you all arrested on purpose. It's going to be glorious.
No, it's a good point, actually. It's a really someone said to me the other day, well, if you disagree with the lockdown regulations, why don't you just get arrested? And I was like, to prove what? To get what accomplished? I was like, if I get arrested, nobody gives a shit. I mean, some Twitter haters will be like, yay, he got arrested. But that's basically where it begins and ends, and nothing will change. But I agree with you. If some sort of very senior political leader in opposition got arrested, that would probably have a significant impact and would at least start a discussion. I think the DA started initially with being a little bit sort of more in on the information here. They sort of started running a kind of podcast type thing, and every day I only sort of saw a piece of one.
It's called Corona Cast, which is not the greatest name, but yes. But at least they have their own public platform now, thankfully, which is a step up.
Yeah, I mean, they started doing that, and I thought, all right, at least, doing something, and it was quite, there seemed to be information coming across, and they seemed to be quite reasonable about things. And then Cyril announced the lockdown, and they basically praised Cyril, and they praised his leadership and all the rest of it. They also did the we are led bullshit, and then they've just kind of been a bit weak since. And the DA, you make a good point about this whole getting arrested thing, because the way they see to solve all problems is kind of through a process-driven method. There's no, the DA are kind of the people who
follow the rules,
always
man.
have
follow the rules.
Yeah,
and if the rules don't make sense, change the rules a little bit, but it's still under the entire system. They always have the
cocktail evening at the sort of museum to announce their latest sort of thing, instead of just doing guerrilla marketing. They're always like, do the right thing in the right way, in the right process. And even to the extent that some people are like, well, these are the disaster regulations. It's like, maybe disaster regulations are bullshit. I mean, I've had this conversation with quite a smart friend of ours who happens to be a lawyer, and the conversation went something to the effect of, I was like, how is this possible? Why can they restrict my movement, my free speech, my right to freedom of association? Why can they do all of this? The reply I got back was, well, there's a disaster regulation that says Section 36 can limit these things. And I was like, if we can do disaster regulations to limit these things, why have a constitution? Like, if you can limit all of those things, and the same people who are meant to follow the constitution can limit them. I mean, my one suggestion was, okay, if you trigger disaster regulations where you take away freedoms and rights, then you are no longer the president. The chief justice becomes the president, right? Like, there's no protection in our law. So in other words, if they want to continue the state of disaster and they can, inverted commas, motivate it, they technically can, and they can take away most freedoms. And I know everyone was like, oh, Section 36 allows a reasonable retraction of freedoms. How is it reasonable to stop you from walking outside your house at 10 o'clock in the morning? It's reasonable to let you at 6 to 9, but to 10 in the morning, that's a step too far. That's not reasonable.
No, it's not reasonable. I think the whole thing is bullshit and illegitimate. And if I was in the DA, I would be agitating a lot more, but having fun while doing so. I'm not there looking, I'm not like the fees must fall permanent victim kind of people. Imagine like going out there on purpose, John Steenhuisen, buying a fucking quart of fucking lager, buying some knockoff cheap ass cigarettes in Kailicha, handing them out to whoever wants it with a camera crew, and he tells the government, come arrest me, bitches. Come fucking arrest me. And when he is arrested, he goes to court and he fucking rails on them and he takes the witness stand. He's like, fuck all of you. This is illegitimate. I'm going to whatever. Fuck you all up in court. This is blah, 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 blah. And then once you're arrested and you go to court, they have to prove why you broke the law. And then you can make a huge statement in court saying why this law is bullshit. And they have to say why it's not bullshit. And that's how you delegitimize the whole thing. And unfortunately, the only people who are delegitimizing the lockdown at the moment are our black compatriots in the townships, dude. Like, people don't think much of them for some reason. I think it is brilliant. Black compatriots in townships don't give a fuck about this lockdown at all. They're hustling, they're making money, they're trying to get things done as much as possible. They're not doing social distancing and bullshit like that. They're getting on with life. As people like you and I, the bourgeoisie, who are fucking the country over once and for all. And it's always the damn whites. And it's the whites. And I'm half white and you half white, so we can say that.
Yeah, it's just The whole thing is just without any consideration, and I think the most frustrating thing is the doubling down. I saw a sea change in the attitude of people. So, I when I started sort of railing against the lockdown and the actions that had taken sort of at the beginning, I got a lot of abuse. And then when there was but I was quite careful about what I was saying because those rules around free speech had just come out, and I had been quite cautious to make sure I didn't get arrested. And I think there's been enough sort of comment and criticism since that it would be very difficult for the ANC to prosecute one person now in the context of everything that's happened. But when the extension happened, I was quite, I suppose you could call it vitriolic. And I got a hell of a lot of hate. But within 3 days, there were a whole bunch of people who started sort of saying, yeah, I'm kind of starting to see where you're coming from. And a number of direct messages as well to go, look, I actually agree with you. And I think this is now a bit crazy and all the rest of it. So there's definitely this change in perception. And, there were those polls about all the people who support a lockdown. I want to see those polls now, because where are they now? We were being told weekly, 80% of the country supports a lockdown. Well, how many support it now? We haven't heard anything since that sudden change in NDZ's thing. Where are you, Ipsos? Where's your latest poll? Why haven't we seen that?
It's not essential anymore. It's not an essential service. But a lot of people are asking in the chat, and this is where I where I struggle to actually have a real answer here. It's like, okay, what can be done? We always explain what the problems are, and we sort of analyze the problems. But what can be done? And I mean, my solution always has been support those institutions that are fighting on your behalf. And we know the ones: Solidarity, AfriForum, Free Market Foundation, Institute of Race Relations, the Renegade Report, Morning Shot, and whoever else is sort of fighting for your rights. But this won't work on an individual basis. You can't undermine something by being an individual. You need a ground movement. And the ground movement for against the lockdown has to be, you need to have like 2,000 people walking at 10 a.m. in the morning, because fuck the law, without masks, right? It has to be something like that. And once there's a bit of fraying on the edge of something, that fraying will spread like you can't believe. The entire Arab Spring was one guy who set himself alight because he couldn't afford bread. One guy. And it reverberated throughout that entire region. And it will need to take something like that spark. As for what that spark is, Jesus, who the hell knows, man? Who the hell knows? It's not something you can predict or something that you can plan.
Look, Ramon, I'm going to use the P word, and it's a pity because I don't think Martin is watching. But I think you can be pragmatic here. So what Ramon said about support, I've publicized information about a Dear South Africa crowdfunding initiative, which is going to serve pre-litigation to the government this week, and will probably go to court thereafter on certain of the regulations. Just to tell you a little bit of background I've had many discussions, more discussions than I would have liked, with lawyers over this period of time. Any of you who've been watching for a while know I'm not the biggest fan of the legal profession. But I have had a lot of discussion with some really great lawyers over this period of time about what's legal and how it can be challenged and all the rest of it. And I think a lot of us, myself included, want to go to court and go, this entire thing is bullshit and it needs to come down. And basically, if you do that, you're going to lose. Every legal person I've spoken to has said there's no way you can challenge these regulations wholesale. You've got to it's like eating the elephant in this instance. You've got to take it down piece by piece. And as you win certain pieces, you make it possible to win other pieces. So that's, I think, a pragmatic way to do it. Support people who have a voice, support people who are challenging things. That's useful. The other thing is look, I think that whether you agree with the social distancing or the masks, or whether you agree with any of these things, you need to consider what your alternatives are. So, for example, if I offered you no lockdown, but you have to social distance and you have to disinfect your hands every time you walk into a shop and you have to wear a mask, right? Those are all irritating things to have to do. They are, infringing on your freedom to an extent. Certainly, the mask, I think, is because stores are obviously they're a private institute; they can choose to do whatever they want. But making you wear a mask all the time is annoying and an invasion of your freedom. However, that said, if those were the three things you needed to do, and you could return to your life tomorrow, I think most of us pragmatically would accept that. I don't think that those are, while I understand people's objections to those things, I don't think they are that bad. They won't have a significant impact on people's lives. They won't make you starve at the end of the month. And they will allow the country to move on with its life. And so that's what I think we should be doing. I think we should be saying, cool, I'm happy to wear a mask. I'm happy to disinfect my hands. I'm happy to social distance. I'm even fine with you saying you can't have gatherings of a certain amount for a certain period of time, till the end of the year or whatever it is. I think these things are very sort of debatable from a science perspective. But if that's the choice we've got to make, then okay, that's what we choose to do. And so we lose out a little bit, but certainly not as much as we're losing out now, because anyone who thinks this is going to go from this, where we are now, to where we're in February, it's just not going to happen that way. There's going to have to be some compromise. And it doesn't matter whether you agree with the compromise or not. You have to decide what is the sort of most acceptable compromise to you.
Right. And I think relying on court cases alone is a terrible strategy as well. I'm not the one, I don't trust the judiciary system so much. There's a lot of ANC lackeys on that, in that system. And if you look at the, I think it's called the JSE, the Judicial Services Council, and who's on that and which MPs are on that as well to appoint new judges. A lot of them are ideological judges, to a fair margin. And we've seen that with that court case that AfriForum took for the BE codes based on relief, right?
Unbelievable.
Yeah, which is a bullshit judgment through and through. So I think the real solution is we need Alan Winde to self-combust and then get arrested, and then this is all over. Simple.
I just want to know, is it windy or wind? Because I think it's hilarious that if it is windy.
Why? Because it lives in the cave. And it's windy there.
No, I mean they should move him to PE. Frankly, he can be the mayor in PE rather.
Yeah, no one
can take Trollop's old job.
No one wants to live in PE voluntarily, despite what Ronaldo says. Right, I think it's been a while. It's been an hour and 16 minutes, so I think we've done rather well. If there are not too many new questions, just one last thing, Wit. Your essential medical opinion on masks. Now, I'm of the view that it doesn't matter if something is efficient or not. If it's useful, it's good enough to use. And I think masks sort of fit in that paradigm in certain contexts. Walking your dog in the middle of the road doesn't make sense to wear a fucking mask, right? If you are in a queue at SARS or in a queue at Checkers or whatever, maybe it makes people less afraid. It gives them comfort. Whether a mask really works, does it really matter at the end of the day?
Yeah, look, I before the lockdown happened, and then when the lockdown happened, I was trying to look for ways to make the lockdown end. And so one of those ways was I spoke to a lot of people in political power and said to them, well, can we not sort of convince the government that we keep the sort of social distancing stuff, the hand washing and all that, and we add masks? Because at that time, Japan had a relatively decent sort of reaction to the coronavirus. They still basically have. They had a bit of a spike, but it hasn't been terrible in Japan. And one of the things that's very common in Japan is people wear masks, and they specifically wear masks in crowded places. So the subway in Japan was still running and ran, I think, until about 3 weeks ago, and then they suspended it for a while, and if I'm not mistaken, it started again. and Japan has not had what New York City had, and they've had packed subway cars. But everyone in those subway cars is wearing a mask. Now, the debate about whether masks work is this sort of 0 and 100 thing I spoke about earlier. They don't 100% work. They don't even 100% work for doctors. N95s is 95% of particles. It's not 100%. You can get an N100 as it happens. You can get one of those masks, and it basically would almost filter 99. So the point is that there's no such thing as 100%. Does a mask work? No, it doesn't block all of a coronavirus. If you've got coronavirus and you're coughing furiously, unless you're wearing probably an N95, some of that coronavirus is going to spread into the air. The point is less of it will spread into the air. And if I'm wearing a mask, less of it will end up in my respiratory tract, which gives me a chance of A, either not ending up with the virus, or B, ending up with a lesser sort of viral infection because I didn't get a high dose of the virus. And there is evidence to show that the higher dose you get potentially leads to a higher infection. That's why some of the younger doctors in Italy, they think, got particularly sick. So these were anesthetists who were intubating patients before we had more information about this particular disease, and they were using either normal surgical masks or not using anything, and they put the laryngoscope in, and they, saw what they needed to see to pass the tube, and the patient coughed, which can happen if you haven't paralyzed the patient adequately. And there you go, massive viral dose right into your face from a patient who's already in hospital, which means they're already sick. So, I think on the balance of things, yes, I am relatively pro masks. I acknowledge the problem with all of this stuff. I mean, the people have raised this point about the immune system and we need to be exposed and all these things. Those arguments are reasonable to some extent. I think we're going to have a massive surge in bacterial infections. We're not meant to wash our hands all the time. You have something called commensals on your skin, which is millions and billions over your whole body, millions of bacteria on your hand. At any given time that live on your hand. And the reason they live on your hand is so that they stop other bacteria from colonizing your hands. They're actually protecting you from bad bacteria. Washing your hands all the time is not a good idea. And being exposed to bacteria for the most part is a relatively good thing. Obviously, there's caveats to that. If you are an immunocompromised person, you've got to be careful. I think everything has its sort of pros and cons. On the balance of where we are right now, I would say, yes, we should probably be wearing masks. But I don't think we should be fining people for walking outside without a mask. And, I went to the shops the other day and I had a mask around my neck. Even though I believe in masks, I had a mask around my neck because I was in a shopping center and there was no one else but myself and my wife walking in the corridor. And it's a 6-meter across corridor. And we were walking alone, and there was a security guard against the one pillar on the side of the building, and he sort of started shouting at me for not wearing a mask. Now, that's bullshit, because I'm not at any risk. That mask at that point serves no purpose being on or off me.
Did you tell him that you're a doctor? You should have. You should have.
Should have made him thank me for my service.
Yeah, there we go. Bang some pots, bitch, before I fuck you up.
That's my view on masks.
Right. And it's never a simple yes or no answer with Jonathan, as you well can see.
No,
one last question, because IZA have asked this a few times, and it's popped up. Information about the A clade and B clade of the virus, or clade, something like that. Is there such a thing?
I think what he's referring to is the mutation of the virus.
Right.
So there are various strains. That doesn't seem to make much difference. Strain-wise, strain-wise doesn't seem to make that much difference, although this is the kind of stuff that's going to take years of research. There was reports of a mutation of the virus which had become weaker. So it was a weaker version of the virus because it had substituted some of its RNA base pairs. I think that mutation is relevant in the sense that it has become weaker, which means that there must be something that's driving that from an evolutionary perspective. There's something that's driving that mutation, which is usually that the virus is not being as successful, which you would assume is probably happening because not able to infect as many people, because people have had it basically, and there's more immunity building up. I'm not particularly panicked about these things either way, and I'm not impressed by them either way either. A mutation in the virus, great, whatever. We still have to deal with the one that actually infects people and makes people sick, and different sort of variations on the virus don't particularly worry me. If you can find one that really starts to kill children, then I would say, cool, I would be worried about that. But we haven't seen viruses that are become established. We haven't seen them really change their stripes, so to speak.
Right.
So
do they get weaker when they mutate? Is that real?
Yeah, they can get weaker when they mutate. They usually get weaker, not stronger. Usually, but that's not always true. I mean, HIV is a rapidly mutating virus. And that sometimes it kills itself by mutating, but not all of the viruses kill themselves, obviously. But yeah, mutation is not usually a positive thing.
All right, one last thing. Apparently, there's a documentary called Plandemic or something like that. I haven't watched it. I mean, people send me so much stuff now to watch, and I don't have a half an hour opportunity cost of my time to watch all these things. In 5 sentences, can you say bullshit or not bullshit? Or is it going to be another half an hour answer?
God. Yeah, I mean, if I had to, I'm probably going to upset people, but I'm going to say in one word, bullshit. But I can tell you that there's some stuff in there which is valid. But I think it goes too far. So I don't really care about that chick. So the Plandemic is basically just an interview with Judy Mikovits or whatever her name is. She's a molecular biologist and she worked with Anthony Fauci at some point. And there seems to be a lot of bad blood between her and Anthony Fauci, and it's an interview between her, and she's clearly got an axe to grind, and she may have cause for that axe. I don't know. I've heard basically her side of the story. We haven't heard the other side of the story. So I think all of that stuff is really irrelevant. And if she had a civil claim to make, she would make a civil claim because she can do that in the United States. They say they destroyed her life and her career and all this, and it was all over a bullshit, basically claim against her, criminal claim against her, which was never prosecuted. She should be able to fight that if that's true. I don't really care about the personal shit. In terms of the stuff that she says in the Plandemic that I think has truth to it, so there's elements of truth. I do think there's truth to the fact that the way science is potentially done these days has problems. The way we develop treatments, there are issues with that. The fact that everyone's gone nuts about hydroxychloroquine, we discussed it at the beginning here. Whether it works or not, and I gave a lengthy answer to that, but they've done a study on remdesivir. It's one study which shows some improvement, quicker recovery, but it doesn't seem to change number of deaths. But they're all saying no, remdesivir is the answer. If it doesn't change the number of deaths, how is that the answer? So in my opinion, remdesivir fits into the same category as hydroxychloroquine. It's something you should consider using. But they don't even know how much it's going to cost yet. They're thinking $1,000 a dose. Now, compared to something like hydroxychloroquine, which is about 30 US cents to produce a tablet, that's where a lot of the fair and legitimate criticisms and arguments come in. And there's clearly people who are trying to sort of profitate. There's one thing in the thing where she talks about how Italy had the Tetravac vaccine, and because they had the Tetravac vaccine, that's why they had the bad coronavirus outbreak. I think that's probably false. I can't see any evidence for that. So I think people should watch it. But I think you should be as skeptical of her as you are of Anthony Fauci. How about that?
You know what? The more we speak about this, the more skeptical I am about the whole thing. I'm just going to say it. COVID-19 doesn't exist. It's an alien plot. I believe David Icke. 5G's causing it. And listen, whatever. The reptilian overlords.
There you go. That is the clip they take out for ENCA. When you finally bring them down, they're going to be like, well-known conspiracy theorists who said this about COVID-19. That's going to be the out-of-context clip they take.
There you go. Shape-shifting reptilians, 5G, and hell, just put in, I don't know, whoever else. Charles Manson. There we go. Charles Manson created it in his secret lab in the prison where he is at. But Jonathan, it's been an hour and a half, and I like you, but not that much. So I think we should call it there. And I just want to say thank you to everyone who joined us. There was close to 150 people at one stage. And it's very kind of you to join us. And if you like the live stream, maybe we should do it a bit more often. Maybe once a month or so, if we don't have a guest on. That might be a good idea.
100%. Cool, man. I would ask people to go back and listen to the Shabir Mahdi show. I thought that was quite a good one.
Yeah.
And if you don't buy into what I'm saying because I'm not a viral expert, then go listen to him because he is a viral expert.
Right. And also the first Corona report. This is Corona Report 2. The first one, people were saying it's fake news, it's bullshit. Look at what happened with the lockdown. There's a difference between a political decision and the evidence in the first Corona report that you told us. And I think that has held up quite nicely, considering what we know now compared to what we've known then, if I'm honest.
Yeah, looking back on it, I mean, everything should be kept in mind. End of January, beginning of February, everyone's saying don't worry, don't panic, probably not a big deal. End of February, beginning of March, people are still saying go out, don't worry. 11th of March, WHO says pandemic. And by 16th to 20th of March, every country has lost their fucking minds and basically ended Western society as we know it. So, you got to take that into consideration. But I think on average it's aged well. Put it that way.
Right, I think so too. So just a final few. Stuart, the man's name is Shabir Mahdi. It's the podcast before this one. It's like our latest one. So go on your app, look for Renegade Report and find it there. And the episode with the guy from Namibia his name is Roland Brown, Rowland Brown. And we spoke to him late last year, I believe, or early last year. I can't remember. But anyway, everyone, have a wonderful evening. Thank you for listening. And next week, we will probably see you again. Cheers.